one of the reasons why we thought it'd be really good to kind of talk about things again tonight is obviously we've all just gone through Christmas and New Year, having lived through another variant of COVID, and lots of people have been kind of worried about it, and lots of people have caught COVID and had it for the first time, or perhaps they've caught it again, or family members have. So we're not forgetting that everyone is affected by this. And there have been some members that have kind of said that they are getting quite worried or upset about the impact it's had on their lives. So we thought it was a really good idea to kind of check in with you guys and find out how it is affecting your lives, or perhaps you've got stories of friends who it's affecting. Perhaps you know people that live places where they have to kind of abide by some rules or whatever. So it's a chance to really have your say again about how things are going for you and for the people in your community. Right, okay, so the first question we had, this isn't Isaac and I, by the way, that have come up with these. This is the media team in discussion, what the media team thought would be really useful to ask tonight. So the question is, Boris Johnson has been talking on the TV about a plan A and a plan B. Does anybody know what these plans are? So if you think, I think I know what they are, put your hand up, and then we'll kind of go round and we'll ask you to say what you think about, what you understand about that question. Okay, so Sunny, you've got your hand up. Do you want to be unmuted and say what your understanding is?
Hello. I think something's about, obviously you've got this new variant that's coming, this Omicron, and it's come a bit, this COVID, that obviously COVID and Omicron's different and COVID's different, but Omicron's not too bad, but it's a bit worrying with different variants coming into the UK, and it's a bit, I think it's about the obviously it's going to be a bit of out of hand. I think this maybe we can't go to lockdown again because we ain't got no money. Otherwise, maybe got be a big problem for the economy and people's and also people's mental health as well, which has impact quite a lot, because of my experience as well. Obviously, I had COVID last year because on Friday gone, it's 1 year I had COVID on the Friday the 7th, so it's quite impact on me and other people. Maybe people got other issues as well. Maybe if we go back to lockdown, I don't think England won't be the same. I don't think.
Okay.
It's a scary thought, but we need to stick together and sort things out, really. The government need to sort something out.
Now, that's really interesting. I'm going to ask some other people what they think about it, but I think this is what we're trying to establish. When they say plan A or plan B, what are they sorting out? What are people telling us? Are we clear? So you've got lots of issues there, but you've not quite said what you thought plan A or B were, because I think it's quite a tricky question, Sunny. So anybody else want to kind of say what they've heard about plan A or B? Annie, what do you think plan A and plan B are? What have you gathered?
Okay, what I gathered. One of them, what you said, plan A, plan B. One of them actually could be like, I know people want to get rid of COVID and the virus. I know Boris, I know we used to go on lockdown, right? We don't want that to happen again, do we? What I'm trying to say is, we don't want. Thing is, I don't want to go down to another lockdown. Because
Okay.
I don't, because it's really struggle. It does really struggle for me. If we do, I'll be really struggling to see people on that. The plans like is to go out more and see people face to face in person, and gradually we're going out to places, but we have to be extra careful.
That's really interesting. So Annie's described two kind of different ways of living. Either plan A or B could be a lockdown, although we're not kind of sure at the moment, it doesn't sound. Or the other way is to carry on, but being careful and living our lives and seeing people.
Yeah.
Thanks for that, Annie. That was really good.
Because at college, right, to say at college, we have to wear masks.
Okay.
But apparently, I sometimes I struggle. Sometimes it's hard for me to breathe in them. So sometimes we're allowed to wear them at college. Sometimes we're allowed to take them off and stuff like that.
Okay.
Yeah.
So
Thank you, Annie.
so Jan, we've got George and then Terry that have got their hands up.
Yep, I've seen George. I was coming to George. George, do you want to say what you gather about A or B, what your thoughts are?
Self off mute. Oh, it is. Thanks, Isaac. I believe plan A is if I believe it right, is plan A is that you're in full restrictions. You have to wear your masks no matter where you are, either going in shops, going on buses, trains, trams, or whatever you're travelling on. And plan B is not is wearing masks, but not as much. They can't force you to wear them, if you know what I mean. They can't force you to wear masks, and you can wear a mask. You have to wear a mask on a bus or in the shops or whether, as I say, they can't say, oh well, why haven't you got your mask on? They can't force it to you. Plan B is more restrictions, more like lockdowns and stuff like that. You can go out but only at certain times. And plan B is that you've got more freedom, but just be careful. That's what I believe it means, so whether I'm right or not, I don't know, but I know Boris sometimes goes around the houses sometimes, doesn't he?
Yeah, I think definitely from all the different thoughts we've got, I don't think it's been terribly clear, has it? Perry, what were your thoughts on what you've gathered about plan A and plan B?
Just to be honest now, it's kind of all blurred. It's sort of all blurred into each other. And I'm at this point where you look at these idiots that decided to throw, what was it, number 10 decided to throw a party.
Yeah.
And then everyone else was in lockdown, behaving themselves. And it's just making me wonder, should I believe anything they tell me? Do they know something we don't? We can't carry on having lockdowns. And I know this is going to sound absolutely awful, but it's like they're trying to control something that I don't think it can. There's a limit to how far you can control it. We can't just stop living our lives. Yes, some people are going to have serious issues, but we can't just stop living our lives because of this virus, which could be around for God knows how long. It's just
really,
nature
really
being rubbish. It's just one of those things.
It's a really good point. So lots of kind of thoughts there about kind of what it means. It'll be interesting when we carry on doing this. Perhaps we'll be able to really look into and find out, Isaac, exactly, and get some quotes what plan A or plan B exactly were. But I think it's fair to say that it's not at all clear.
Would you like me to show people what the different plans are? Should we go on?
Would that be helpful, guys? Do you want to have a look at it now?
Yep.
To be
Yes,
really
please,
clear?
yeah.
Yeah, that'd be great. Okay, that's good.
No worries. 1 second. I found a really good article that's managed to explain it properly. 1 second.
Which we should send to Boris. Can you please read this?
Yeah.
So when you're next on TV, you could explain it better, please.
I don't even think he knows what he's doing, Jan. So what are you on about? I'm getting very political now. Sorry about that.
Oh, you and me both. You and me both.
It's really difficult for us not to be political when these decisions are being made, but then you're also reading about people breaking them, and those are the ones who are making the rules.
But we're not being party political. It wouldn't matter who the leader was. If any leader wasn't being clear or seemed to be breaking rules, we'd all have an opinion about it, wouldn't we? No matter what kind of party they're from. So,
I mean, one of us lot could be prime minister. We've got more common sense than Boris Johnson than other silly leaders breaking their rules, and could be this quite intelligent. So, I mean, yeah.
I totally agree
well
with you.
said.
Yeah, no.
Okay. So shall I read out what it says that Plan A is? Yeah. So this was in the Manchester Evening News, my part of the world.
Yes.
So Mr. Javid told MPs that the 5-pillar plan is a comprehensive plan to steer the country through autumn and winter. So this includes booster jabs for over the 50s and vulnerable people, offering the vaccine to 12 and 15-year-olds, developing new antiviral treatments, continued NHS test and trace, and free PCR tests and lateral flow tests. So you may have been hearing in the news there's been some problems with people accessing them, haven't they? NHS frontline and social care staff highly likely to be vaccinated as a condition of deployment, encouraging people to meet outdoors where possible and to let fresh air in. You may have seen some of the adverts. I think there's been some adverts showing that. Wear masks in crowded places. We've all been saying that. The biggest flu jab, so that isn't the COVID jab, that's a flu jab rollout. Supporting the global effort all around the world for vaccination and maintaining border defences. So watching who comes in and out of countries. International travel rules to be announced later. Right. Then we had Plan B. So Javid announced there was a backup plan. Well, Nelly read about the exercises.
I know, sorry about the adverts, everyone.
Varicose veins. So he said, we have seen how quickly this virus can adapt and change. So we have prepared a Plan B of contingency measures, so backup measures, that we will call upon only if they are needed. So you're right, the B was the more serious one. So A is what we want to be doing, and B is going to be more serious if things get kind of worse. And they were going to do that if it was supported by the data, all the facts and figures to do with the health professionals, to provide or to prevent unsustainable pressure on the NHS. These measures would be communicated clearly and urgently, the need for caution.
Government scientific advisors will be keeping an eye on hospital admissions and how overwhelmed the NHS is. So the advisors are going to be looking at the different people who are coming in, and Plan B includes mandatory use of face masks. Everybody has to wear them. COVID certification, which is vaccine passports, and where you get codes on your phone to prove that you've had a vaccine. Working from home. Prime Minister Boris Johnson said not all measures would necessarily be brought in at once, highlighting that due to the population's immunity against the disease, smaller changes can have a big impact. So those are the differences between Plan A and Plan B. Teresa, you've got your hand up. What would you like to ask?
It's just going back to what Jan was saying. I was shouting at television earlier. You should have heard me on the news. I called her a and a
Uh-oh.
yeah, bad language.
What were you watching, Teresa? What was it about?
On the BBC One, they were talking about lateral flow tests, and they were saying, "Oh, people should go and have one." I said, "They haven't got them in the." Sorry, I thought this was recording. You know.
Well, you've been very good. You've gone bleep bleep. Yeah.
I went to Sainsbury's for Dad today because he's obviously we've lost the car.
Yeah.
And so I went up to the counter getting some turmeric tablets at the desk in Sainsbury's.
Uh-huh.
And it said no flateral. What is it?
Lateral.
That one. And it had a big piece of paper on it. And I've just seen it on the news and said you should have one, but there's no shop. There's nothing, because we've only got 2 left at home.
Yeah.
Brother got them for us, you know. We took them when we were away as well, you know, from my brother's house.
So that's a real issue, isn't it? That if we're being told to keep on getting yourself tested, if you're going to go out and about, keep testing yourself, make sure you're okay. If you're not, then you'll know and then you'll isolate. And now we can't get the tools as easily. So it is something that, so if you're having any trouble like this, be sure to let us know. So Teresa, you're having trouble. So if anybody else is having any difficulty, it'd be good to know, wouldn't it, Isaac, so we can collect that information.
Absolutely, absolutely. Duncan, you had your hand up. What would you like to say or ask?
Just wondering that with people out there with who haven't had the any jabs at all, would they? Is this compulsory, and is this going to affect them with their medical conditions?
Duncan, what for people that aren't having it, there are different reasons, aren't there? So some people it's like a moral thing, they don't believe in them. Some people medically feel that they can't have them. So people that are medically kind of not having them, there'll be different kind of, even if it gets really heavy and they're really, really pushing for people to have it, they're not going to be imprisoning people. It's going to be very hard. They're going to have to keep working hard to try and encourage people or educate or find out more and give more information. What I have seen today that may be of interest to anybody that hasn't been vaccinated and has got any medical kind of issues, Gemma has sent out a link for us to share, because there's some information that's coming through for people with a learning disability that may have chosen not to get vaccinated, and they're giving some reasons for you to think about again, perhaps getting the vaccination. So we could share that, couldn't we, at another meeting, Isaac? Or
absolutely.
Or if you want it to be sent to you, Duncan, if you'd like that information to be sent to your email, we can kind of forward it on.
Yeah. Okay.
Yep. Oh, that'd be good. Okay.
I think a lot of people. Sorry to butt in, but I think a lot of people have done it. A lot of people have done it on religious grounds, haven't they? A lot of people say, "Oh no, it's against my religion to have that. I'm not going to have that because of my, not naming any specific religions, but a lot of people have. I mean, a lot of my friends, which are some of them very religious, say, "Oh no, we're not going to have the jab." And I keep trying to say to them, I said, "Well, if you have the jab, because it will help you in the long run. It may not get rid of it completely, but if you do get it, you'll get a very mild form of it. You won't be as ill as some people that some people that probably are in a very vulnerable condition that could get it really bad. So it swings and roundabouts, a lot of it, isn't it? So
I think the religious thing, my understanding, it's not that it's to do with a god that people it's not to do with specific religions, it's to do with the fact that people believe that God will protect them, that they don't need the jabs because they believe in prayer and they believe their body healing themselves. So
I've had those people at work.
Have you?
On the till, I will completely avoid the subject of jabs on the till at work, because I work in the magical land of retail. And I'm with every single, I'm probably getting exposed. I'm getting exposed every single day. I know that for a fact. So I can't. I have to keep a mask on. But I've had some people get really heated over it.
Yeah.
And this is me not trying to bring it up, because I won't bring up any sort of politics when I'm at work at all. But you can sort of hear people. You can hear a fight almost kicking off, and then you just politely steer away.
Is there any more questions from people who haven't spoken about this, about the first question, before we move on to the next one? Adam, are you trying to unmute yourself?
Yeah.
All right, so I've unmuted you, Adam. What was it you'd like to ask?
Yeah. Well, yeah. Well, yeah. Well, I was actually listening to Ray 4 this morning about people, have need an actual flow test, but don't need a PCR test. And I thought, well, and I thought, well, if the natural flow test comes back positive, they're gonna have to do a PCR test.
Yeah. No, you're right.
Yeah.
No, I think what I heard as well, Adam, this morning is they're saying that if people self-isolate, they don't have to then go and get another PCR test. They just stay self-isolated. But I think we all have to, like Adam, listen to the news, because I feel what's happening is it's changing all of the time. So if anything happens in your life and you're not sure, I think that's absolutely fine. Like, ask somebody, check it out, because the government are trying to keep on top of it, to keep the wheels of commerce, of everything going and life going. So things are changing a lot. So I think it might be a really good idea, do you think, to have the media team, just to have, perhaps, Adam, this is something that you can think about, that perhaps, I don't know if we can do it weekly or fortnightly, that we just send out a little bullet sheet with some, this is what we found out and what's going on in the news, and we could just put a couple of things and send it out to people. Would that be helpful, guys, to kind of get something?
Yeah, that'd be great.
Yeah, bit of a
Stop watching the
summary of
news.
what's,
I've stopped watching the news because I can't deal with it anymore.
It is difficult because
it's difficult. I understand. It's difficult, but it's important.
I'm finding I don't trust what I see anymore.
Yeah.
I'm sort of beginning to wonder if the full truth is being told. And I know there's a lot of misinformation out there, and you'll read one site, it debunks everything else, and then it just keeps going and going and going. Eventually, you don't know which way is up.
Yeah. I don't blame you.
Thank you for that, Perry. I think if you've got any worries, or any concerns, you're out there kind of every day dealing with it. We are here for you as kind of staff members. So if you want to kind of catch up, or, text me and say, can I have a chat? If you want to have a real moan fest anytime, I don't work in retail. I don't deal with what you deal with. And I'd be very, very happy to just tell me all that you're thinking or feeling. So do give us a call or text me, and I can give you a call back.
Just before, I'm really sorry. We're going to have to move on to the next question because it's already gone 1/2 past. Can I just? Oh right, sorry, I've got it now. Let's do question 2.
Okay, guys, so we've talked a little bit about it, but this is trying to get to the heart of how do you feel about restrictions? And we're not going to say what the restrictions are, but is it clear to you what the restrictions are in place at the moment? And how do you feel about any restrictions that have come into your life because of COVID? So
please put your hand up before you start talking, because and we will focus on people who haven't had a chance to speak so far. Polly, I'll unmute you. Hi, Polly. What would you like to say?
I find the restrictions clear, that I'm finding it frustrating that the rate about the rate keeps going up and keeps going down, then up and then down again, and it's frustrating because of the rate. I can't do some of my activities I like to do at the moment.
so how has it impacted on your life? What kind of things are you not doing at the moment, Polly?
Like my sports activities, like the Dundee and Cat ones.
So face-to-face groups, are they the kind of things that you're not doing as much?
Yeah,
Okay. So that's a real restriction on your life because of organisations and how they've had to kind of pull back and not offer face-to-face things in the same way.
yeah.
Is that right? Okay, thank you for that, Polly.
Is
Does
there
anybody? I can't see everybody, so
No, so yeah, I'm just going through.
yeah.
People, does anybody want to respond to question 2? Duncan, what would you like to say?
That's with me, that I'm getting on with my life despite the COVID restrictions, because I don't say I'm ignoring it, but if there are restrictions, then I'd have to abide by it, like the COVID passports. If that's introduced, like I don't go to nightclubs, so I don't need a COVID passport. So with I think having one-to-one sessions face to face is better, but at the same time that we've got to learn to do Zoom meetings, as it could be in the short term, but we don't know. But stay positive.
Yeah, and thank you very much for that, Duncan. And just to welcome Ian Kimber, who's just joined us. Because there is too much background noise, I am going to have to start muting people back, because that's it. Just because just so that everybody is able to hear themselves.
Can I just ask if Lucy, is there anything that you wanted to say about the restrictions or the effect that things are having on your life? Do you want to say anything?
Not really. Well, my partner, I must be the luckiest person in the world, because all my friends had COVID in the past and I managed to escape it. So I must be the luckiest person in the world.
Whoa. Oh, that's good. That's
But
good
I'm
for
not
you, isn't it?
arrogant or anything, but
No.
it just amazes me how my partner managed to get COVID and all my friends, and I was with my partner before Christmas, and she went to my house and stayed overnight, and she managed to get COVID and I didn't, so I'm a bit confused why Anyway, it's good that I didn't have COVID. But I was just a bit confused because I thought you could catch COVID from anytime, anywhere.
I think your experience, Lucy, isn't unusual. I've heard of families where, say, 3 people have got it and 1 person hasn't, and I
So is that
don't know
normal?
the medical reasons, but some people do not get it. But
Mm.
how about the restrictions then when your partner and friends had COVID and then they had to self-isolate? So that's a restriction, isn't it? When they've got to kind of,
Yeah.
how did that feel for you, kind of, having somebody that you're so close to and not be able to see them and things?
I felt a bit frustrated, but you have to abide by the rules. But she's out of isolation. She came out on 1st of January, and I was been able to see her ever since. And she just left my house today, so
I'm glad.
we're just carrying on as normal. But obviously, she doesn't want to get it again, so we have to wear masks. And it's funny because we both got the same mask. We both got the same. So we both got twin masks. So every
Excellent.
time
It's
we
just
go,
what you need for the new year.
yeah, every
Yeah.
time we go down the street, and people say to us, "Oh, you're twins, are you?"
Oh, how funny is that? But it's interesting listening to people talking about the human resilience, how important it is to dig deep, and with all restrictions and all the things we're hearing on the television, how scary it is going to work, that all of, so many people on this Zoom are digging deep and carrying on. And I think that's, all credit to you.
And can I just add to that, Jan? They're not just digging in there; they're following the rules.
Yeah.
As well.
We have to be extra careful now.
Yeah.
Yeah.
Because
Yeah.
she has it again.
Yeah. Well, Jan.
Yeah.
Jan,
Sorry, Isaac. I didn't mean to interrupt.
Jan.
Yes, Adam. Yeah.
My sister, my sister had it. Think it was last week. I mean, she's all right now, but she's been working from home a lot.
Yeah, it's interesting, isn't it? It's really interesting. We're all doing what we can to keep ourselves and others safe, but things happen, don't they? And I think there's a level of acceptance. If everyone, so we've gone on to question 3. Okay, we're going to move on because we've got 5. I think we've got 5 or 6 questions. We'll see how we get on. So this is question 3, guys. So we've been told that we don't need to go into lockdown at the moment. Bearing in mind all that you've said about people getting kind of COVID or kind of, the worries that you've got, what are people's feelings about not going into lockdown? Has anybody got any particular views about us not going into lockdown? Sunny, what do you think?
Well, lockdown is a bit tricky. It's a bit a tricky question. I mean, we've been locked down about 3, 4. I don't know how many times we've been locked down. So it's like a roller coaster. If we're going to, obviously we're not locked down at the moment, but if we go into lockdown, it's going to be a bit of a what's the word? It's going to be a disaster, really. It's going to be like people be what's the word? Be like 2 years ago when the first COVID come, people like people were bulk buying and taking all the food, and that was that was a bit of a problem, especially people like me. We couldn't go shopping to go and get their food, and especially and the people, elderly people who can't go out. And it's going to be we're not locked down yet, but if we go lockdown, it's going to start like a roller coaster again, like it's gonna be like chaos, if you know what I mean. Like it's gonna be a bit too people are, and then people be like, if they can't get no food, people might be what's the word? What's the word? Like I don't know, shoplifting. I don't know what.
Yeah, I know
What is
what you're saying. Like the kind of the rules that we live by in terms of we go shopping, we get what we can. When things start to change and people go into lockdown, start to panic buy, it changes how people behave, doesn't it? So you're worried about that.
Yeah.
Right, Perry's got her hand up. We're going to ask Perry. Perry, what do you think about lockdown, not going into lockdown? What were your thoughts?
I think at the moment we just sort of see what happens, but I don't think we can go into another lockdown. I mean, as I said earlier, we can't. If they're really concerned about this, why can't they just beef up the NHS with more staff? That's
a
what I
good
don't
question.
get.
Yeah.
Why don't they do that? You know, I just kind of feel like an element of common sense has gone out of the window, and they're trying to control something that I think no matter what you do, it's going to just rip. It's going to find a way to rip through the population, and I don't think there's much we can do about it.
Did you see on the news, because there are staff that are off sick and the NHS has changed the shape of it because of Brexit and kind of nurses and doctors leaving? Have you heard that there's been kind of army staff that have been deployed? That some army personnel have gone into hospitals?
Yeah, I heard that.
A little bit.
Yeah.
The army have been. I know in some parts of the north of England they've been driving the ambulances.
Yeah.
Because the ambulance crews are also catching COVID, and the Omicron variant was really contagious. We've got Duncan and then Polly. So Duncan first.
That if we don't go to lockdown, I don't know what the first lockdown was because I was in Australia. So, but when I did come home, I was over at my brother's house. So I had a brief lockdown then, but I can keep busy at all times my end by doing woodwork, taking the dog out, which is exercise. That's going on Zoom meetings, that basically keeping your brain cells working at all times.
I thought that it's good that in one way they're saying that the cases are rising, so really they should put a lockdown in place, because it's just they're saying one thing and doing another thing.
The remarks that he just made were really important, particularly because we're told time and time again that the Omicron variant is more contagious, is going to affect more people, and it's affecting the NHS and it's affecting the NHS staff as well. But they know that people are tired of lockdowns, and that's probably why they're not putting lockdowns in. They want the economy to get back. They want to try and get things back to normal. But it's the confusing thing of being told that you've got a more contagious variant, but that is but we're not doing any lockdowns. I don't know if there's anything you want to add to that, Jan.
Yeah, I wanted to say that my understanding is that one of the main reasons for the original lockdown was to protect the NHS so it didn't go under. So if they feel that the NHS will somehow manage, no matter how many staff get ill, if they can get through it without a lockdown, that's what they're aiming for, that if they can somehow manage to keep the NHS bobbing along, even if it's really, really fragile, because it's about the number of deaths, isn't it, and the number of hospitalizations and how many beds that takes up and how long people stay in. So there's things that we don't know about, I think, Polly, that go on behind the scenes to do with how hospitals and things like things you were saying, Perry. What don't we know? What aren't we told? It is a very political arena running the country, isn't it? Or running the world, all these different governments. But what I like is somebody like Duncan's view that's very kind of determined to just get on with things. I think that's really very valuable. So it's trying to balance ourselves, isn't it? We've got Annie and we've got Teresa and we've got George. So I think Teresa first, you had your hand up. Do you want to say anything, Teresa?
I'm not muted. Oh, you've done it now. Thank you, Isaac. My doing technology. What are we talking about? Sorry.
Lockdowns.
Oh yeah. You know, my dad's going to be 90 this year. He's very vulnerable about going out. He doesn't like going out unless he's safe or something. You know, what am I talking about? You know, he's very vulnerable person, and obviously we haven't got the car now, so I'm sort of like doing extra shopping for him. You know, going out and getting his medicines and. Do you understand?
Yeah. No, we do understand. Is there anything you want to tell us about? We've been told that we do not need to go into lockdown at the moment, but what do you think about that? Do you feel that we need to go into a lockdown or not?
Well, it's just a rumour, isn't it? Like probably what Perry would say. It's a rumour, you know. We don't know what's going on, and everything changes because I don't like changes, you know.
It's really interesting, isn't it?
I couldn't see anybody, and then I was struggling with the rules and doing this and doing that, and you know.
Thank you for that. We're going to have George next. George, you've got your hand up. We're just waiting for you to be unmuted, George. You're muted. Okay,
Thanks,
you're
Isaac.
unmuted now.
If we're do go into a lockdown, what's it going to do is what Sonny said, what's it going to do to the economy? The economy could go downhill straight away and we could be back, more or less back to square one of, you know, people won't be working. A lot of shops will go out of business because they won't have nobody going into the shops to buy stuff. A lot of companies are going to liquidation because of because they won't be able to make anything. You know, you've got the steel works would go. Well, they won't be able to do any more. You know, making any steel products and stuff like that, and people won't be buying anything. We won't be able to sell anything abroad because you know they'll say, "Oh no, we'll go buy somewhere else. We'll go buy from China or we'll go buy from Italy or something like that." And as I say, our economy will go downhill straight away, just because we've gone into a lockdown for, you know, no matter how long you would do the lockdown for. But I can't see it myself. But whether we will or not, I don't know. But it's going to be very hard on the economy if we do. You know, it's just as I say, our economy just go straight down. You know, and it'll be a lot. It will be. I think it will be a little bit of a burden as well on the NHS because you'll have more and more people probably saying, "Oh well, that I don't feel very well." They'll go into hospital, and the poor old nurses will be running ragged, you know, and the doctors will be trying to catch up with themselves, and you know, so it's going to be very difficult. But that's my opinion on, you know, whether we go into a little lockdown. I don't know, but you know, it's very, very difficult, you know.
I just want to say something you've just said there, George, because some think that, I don't know if you're hearing on the news a lot, it's about kind of inflation and prices and gas and electricity and food. And we're already, the repercussions of going through a pandemic all around the world, we're already financially as ordinary people paying the price. And I think it's important to say, because you guys, none of us are loaded, are we?
No,
Unless we've
no.
got a secret stash, you
I
know,
wish
all
I
of
had,
us,
mate.
you know, haven't got lots and lots of money. And
Yeah.
if anybody finds themselves struggling more and more, it is important to talk to us as supporters and share any of those kind of concerns, you know. Yeah. So we've got a message here from Chris. Thank you, Chris, saying that you hope you don't have to go to your mum's again, that you want to stay in your flat. That's another big issue, isn't it? Kind of having to go into lockdown with somebody else and your own freedoms kind of getting taken away.
Yeah,
Really good point,
yeah.
Chris. Okay. Annie, and then shall we move on to the next question?
Sounds good.
Yeah, Annie, yes, what would you like to say about lockdown?
Yeah, again, sorry. Is it under the lockdown, right?
Yeah, it's what do you think about the fact we're not in lockdown now?
Because if we're not in lockdown, I don't feel like safe. It's because I'm saying that because I know we have to be careful. Like we're out of lockdown. We still need to be careful. We still have to wear masks in certain places. Yeah, just we have to take it easy when we're not in. Yeah.
That's a really good point, because lockdown does impose on us a safety. We can't see people, we've got to stay in more. It gets riskier when we're out and about, isn't it? And Annie's made some really good points. If you're out and about, we all then have a responsibility. There's a lot of thinking about it, a lot of practical things we have to do. Thank you for that, Annie. We've got a funny question now. We've got question 4. So imagine you now work for the government. I'm sure you can all imagine it. So if you work for the government, what restrictions would you put in place? So if you might have thought about this, or you might have talked about it with a friend, or heard this question for the first time. But if you were employed in the government, what kind of restrictions do you think you would ask people to abide by? Sunny, what did you want to say?
Well, restriction. If I work, shall I mute myself? Oh, I've done it already. Oh, basically, if I am working for the government, obviously obviously use my common sense and all that. But right, first, well, restrictions. People can't go to, like like last year. People can't go mix with going to pubs and stuff like that, and bars and and also maybe obviously everyone needs food and try and live on, try to get energy and all that. Make sure that people can get their food, from the like they go to shops and all that, because it's very important to get their food. And obviously you can't go to mix with people, and also and obviously what else is there? No, but like people got not going having parties and all that. But I mean the shops. Some of the shops, I said, like you got Poundland and Sainsbury's. All them shops got to be open because people get their food and essentials like Boris did 2 years ago, like to get their essentials really.
Interesting. So I think what I'm gathering from that is one of the restrictions would be to think about big gatherings, big kind of nightclub, big venues where there's lots of people. We've just had a message from Bavina saying there's only 2 minutes left, probably only one now. Should we show people the other questions, Isaac?
Yeah.
Right. So we'll see if we can just have one answer for each of the questions. So this is question 5. This is a big one. In this country, the population is 70 million people. 25.5, so 23 and a half. So 23.5 million people have not had any vaccinations. What are people's thoughts about that?
in the world.
1 second.
Well,
1 second. Please don't just shout out. And also, we need to have people who haven't spoken.
Yep.
Gordon.
Okay. Bhavina, do you want to say anything about that? So it's less, it's not half, because it's 70 million. If it was 35 million hadn't had it, that would be half of the population. So it's less, it's 23 million. So it's under half, but it's still a big number, still a lot of people. What are your thoughts about kind of hearing that there's a lot of people that haven't had the vaccination?
I don't know, but that's quite a big number to hear.
Did it surprise you that it sounds?
It's just surprising and quite shocking to hear how many, people going for the, for Jackson and and all that.
Okay. Anybody else want to say anything about that? Duncan, did you want to say something?
Medical restrictions, or it could be their family's advice, or you could just go with your gut feeling. Go with your first gut feeling, because it never goes wrong.
Interesting. So one of the things that perhaps if we had a discussion again, because it's going to move on to the next question now, is that that's just a figure, isn't it? We don't know how that figure's broken down. We don't know whether half of those people, it's kind of medical exemptions, they can't have it. We don't know whether it's people politically active saying that they won't take it. We don't know, do we, Duncan? So it's a really good point. Okay, we're going to finish now with the last questions. We're going to just read the last question to you. Is that okay? We've got one more, is that right? Yeah. Okay, so this is the last question, question 6. Okay. Some of our members live in supported accommodation where there are COVID guidelines and rules. If you were a manager, what rules do you think would be important to keep people safe? So it's a bit of a tricky one, this, but just imagining you're a manager and you're taking care of people kind of living in close proximity, perhaps in their own flats or sharing one flat or house together. If you were a manager, what kind of things do you think would be important on your mind to keep people safe?
I mean, obviously, you have to keep people safe in a care home, because that's important. Because you have to keep them safe, in the environment they're staying in, keep the rooms clean, tidy. Obviously, where they're cooking the food and all that, and it's important, and yeah.
Thank you, Bhavina. We're just going to move on to Polly.
For everyone to wear face masks. PPE.
Yeah, face masks and PPE for staff. Adam, you live in supported living as well. What rules would you have?
Well, maybe letting the maybe let maybe giving the tenant a bit of space if they wanted to do it, and if they wanted to do the job themselves.
Right. Okay. So you're talking more about staff allowing you to do the things that you want to do. Is that what you're saying, Adam? Is that what you're?
Yeah.
So what you're saying is that during COVID-19, you'd like to actually be left alone more. left alone to your own devices.
Yeah.
Do you know what's very interesting? I'm just thinking another time we could perhaps ask the question to you guys. Are you clear about what Advocacy for All are telling staff that we must do? You know, is it being clear enough to you about what guidelines we've got to follow? You know, how have we been doing things? Because we all like to think that we make things very clear and we're transparent and we give good information, but it's not always that easy. So it'd be very interesting. Perhaps we could look to ourselves a little bit and examine this, because it's important that whatever information we give out, we do it in the best way possible, and you guys feel good about it, that you are part of the whole process.
Really, really huge thank you to everybody for staying with us and for having this really, really important discussion. This isn't going to be the last of the discussions. We'll be talking more about this. We can see that there is a need for us to talk these things through so that everybody feels safe. And thanks again. Have a lovely evening, and we will see you all very soon.